Good evening. Welcome to the Pandemic Podcast. My name is Astin-Gregory. This is a Friday night rant. I don't know if you've seen the article today from the Daily Mail where Chris Whitty warns Britain that it faces a prolonged period of excess deaths, not caused by COVID, no, but due to the collateral effects of lockdown. Now, imagine anyone talking about the potential collateral effects of lockdown. It's not like during the entirety of the last 2 years that people like myself have been banging the drum about the inevitable harms, both in the short and long term, caused by lockdowns. So tonight's rant, I'm going to talk you through the article that the Daily Mail have put out featuring that man who seemed to have disappeared into the hole that he crawled out of. And for those of you who are new to the show, apologies. This is a rant episode. I do have my occasional rants where I just go off on one about the state of the world. You will also find interviews where we look at things with a little bit more nuance and balance across our channels. But tonight, I have a classic rant. And I'm going to start by saying, if you're watching this live, then congratulations, because you're watching this on a platform where we haven't yet been censored. So if you weren't already decided that you no longer want to watch because I'm in a rant mode, well, you may think, why is this guy being censored? Well, let me just tell you, I'm going to share my screen a moment, because this afternoon, I received a notification from Facebook to say that my account is restricted. So apologies, I've taken screenshots from the actual flow of information that I was presented with on the Facebook platform this afternoon. It's a little small on the screen, but I'll talk you through it. On the left-hand side, it says restrictions. These restrictions come in three forms. Number one, your account is restricted for 5 days. So you're not watching this like this. Highly unlikely you're watching on this Facebook right now live, because I can't broadcast live to Facebook at this moment in time. My group activity is restricted for 28 days. So for the next month, I can't post in groups. And my posts will be moved lower in the feed for 27 days. So I'm unable to reach you on Facebook, and Facebook's algorithms will be doing their darndest to make sure you don't see anything I have to say. Why would this happen? Well, according to Facebook, our standards on misinformation, this is what it says here, could cause physical harm. We don't allow false information that could cause physical harm. In some cases, this includes information that recognized health organizations could mislead people about how to cure or prevent a disease, or that could discourage people from seeking medical treatment. Get reliable, up-to-date information about the coronavirus COVID-19 from the World Health Organization. That's next. And then it says you have multiple restrictions on your account because you previously posted something that didn't follow our community guidelines. This post goes against our standards on misinformation that could cause physical harm, so only you can see it. If your content goes against our community standards again, your account may be restricted or disabled. If you disagree with the decision and you think they got it wrong, full stop. You can disagree with the decision if you think we've got it wrong, full stop. The next page then said, what would you like to do? Your post goes against our community standards on misinformation that could cause physical harm. So no one else can see it. Okay, you've already told me that. The only option you've given me, however, is to accept the decision. As you can see here on the far right, you can only accept the decision. So despite the previous screen saying if I disagree, I can disagree with the decision. But I may be able to mentally disagree with the decision, but I can't physically disagree with the decision, because I've only got the option to accept the decision on my screen. So when no one else can see that, no one else will be able to see your post, and I'll no longer be able to request a review. So this post is now the post in question has now been banished from Facebook. So I did warn you this is a rant. I was going to originally call this conversation, this episode, what's peed me off on this Friday afternoon. I wanted to squeeze this in because on the basis that it's ridiculous. Now, you might be thinking, what was your episode about, Dan? What were you talking about that would warrant such a censorship? Or what would warrant such a set of restrictions on your Facebook account? Well, let me show you, because fortunately, one of the other major big tech platforms hasn't yet shut me down for the same reasons, although I wouldn't be surprised if it's coming. So let me take you to another screen, which will show you where exactly this problem has arisen from. And then we'll get to the subject matter at hand regarding Mr. Whitty. So this is a little strange moment, because I'm going to bring you to my YouTube channel. In fact, you can't see it now. This is the video. But on my YouTube homepage, you can see I'm loud live, and it'd be like looking in the mirror recording oneself because you can see the live video on the homepage. But this is the video in question: China rising up against COVID restrictions. So I recorded this last week, simply reporting on, or earlier this week now, I lost track of time, reporting on exactly what's happening in China, the latest information about the protests, the uprising in China. There was no conversation about COVID-19. There was no conversation about treatments about COVID-19. There was no conversation about physical harm. There was purely a conversation about the protests in China. So for whatever reason, Facebook has decided that this is harmful information and that you as a grown adult can't make up your own mind about what's appropriate for you to consume. So this particular episode, China Rising Up Against COVID Restrictions, has been taken down off Facebook, and I've been put in naughty corner for the next month, where they're going to make darn sure that my content doesn't reach you. So if you're watching this on any other platform, then thank you for being with me. And as a result, I ask you, I plead with you, hit the share button wherever you're watching this, go post it somewhere else. People need to know that the important conversations, like the fact that China, after 2 years of devastating zero COVID policy tyranny, are now having the conversation about this issue in the Western world shut down. And I even spoke within that episode how big tech has been censoring the protests in China. And here we have it, full stop, on Facebook. And what's interesting is on Facebook, I had already amended in protest my profile picture to a blank white circle, which I'll also show you on the basis that it's a relevant piece of the puzzle. Because in China right now, you'll see that the protesters have been presenting blank pages of paper to represent the fact that they have no voice. It's a blank sheet of paper, so it has no statement. So by making no statement, they're making a very powerful statement, because in China, if you protest, it comes with very severe consequences. People have literally disappeared in China for protesting, never to be seen again. So I altered, prior to my censorship, my profile picture to a blank white circle and a blank white template to join the protest in China. And lo and behold, several days later, my account is suspended for my post around the protest in China. So isn't it timely that I did that? And I invite you to join me in doing this. I invite you to join the cause. I invite you to just take a stand by changing your profile picture to a white background, a plain white background, to say, if we can't say anything, then we'll say nothing, as a statement in itself. So here I am, hanging on by a thread on all the other platforms. People ask, why haven't you moved yet to the mainstream? Like, why have you moved? Why are you still using these mainstream platforms? Why haven't you moved to Rumble, Odyssey, etc.? Well, we're already on Odyssey. We are on Rumble. We're already broadcasting to those platforms. But the reality is, a large proportion of society who we're indeed trying to reach are still on these mainstream platforms. And yes, it's important to use these new and upcoming platforms. We're very passionate about doing that. But simultaneously, we are also keen to continue to reach people that perhaps aren't on those platforms. So tonight's episode is entitled Rant. Whitty warns Britain faces prolonged excess mortality. Let's get into the main subject of the day. I'm going to switch over now to the article in question, featuring our dear friend, the Chief Medical Officer, Sir Chris Whitty, warning Britain that it's going to face a prolonged period of excess deaths, not caused by COVID, but due to collateral effects of lockdown. If you are new to this podcast and you haven't watched it before, for the last 2 years, under the title of the Pandemic Podcast, I have been, and my team have been, examining all of the issues. We've been pulling apart the science, the data, the social implications, the political implications, and of course, warning excessively about the excess collateral damage that will inevitably follow from these crazy policies. So it's not like we now reach the end of 2022 and look back and think, oh, my goodness, we couldn't have seen this coming. We could see this coming. We could see all of this coming. We could see every consequence coming, so that we could see the healthcare implications. We could see the economic ramifications. We could see the education implications. We could see the mental health implications. We could see every possible consequence of these decisions. We could also see that whilst the viral threat was certainly a risk to a proportion of society, then if we'd indeed taken steps, if we'd wished to give those who are at risk the opportunity to have some form of shielding, then we could have supported that, willingly supported that. But rather than shut down the world for everyone, where now we are all suffering the consequences due to the economic problems, the healthcare issues, and the fact that many people, including children, are now suffering mental health issues at a scale that has never been seen before. All of these things were entirely predictable. And, those of us who protested were, told that we were acting against the common good. The common good, in my view, is minimizing the total harms. And that's a phrase I used several times during the course of the pandemic podcast, is how do we minimize all harms, including human rights, civil liberties, but more importantly, these consequences that were entirely predictable. So if you weren't aware, Chris Whitty's going here to say that these excess deaths we're now seeing, which we've been seeing for weeks at scale, are as a result of government policy. It's effectively, it's not an admission of guilt or wrongdoing. He hasn't gone that far, but he is saying that because thousands of people missed out on routine treatments and diagnosis and appointments because people didn't have access to the hospital system, the healthcare system, the GP, they had all these virtual appointments, your backlogs. Now, because of all these things, we're seeing these excess mortality. And of course, there's no conversation here. I mean, every time I see this guy's face, it makes me rage. Again, rant on a Friday. There's no mention, though, however, of the possible collateral damage of the mass interventions outside of lockdown. So we've seen the non-pharmaceutical interventions as referenced here, but what about the pharmaceutical interventions? What about the pharmaceutical choices made and the continuing brushing under the carpet of the consequences that have been caused by such a major rollout of an experimental intervention? And, just by saying this out loud, the little thread that I've got left on the mainstream platforms on YouTube will probably just be diminishing in front of your very eyes as I enter into this conversation, knowing that, the powers that be don't want us to talk about these things. But if you were any uncertainty about the excess mortality, let's go to one of my most commonly used sources, which is Our World in Data, which shows the excess mortality decimal causes compared to projections based on previous years. You can see here, this is back in 2020, the spike during the peak of COVID-19. And I'll do a lot more on this because there's a lot of analysis that's now been done on data. And again, I'm not making a concrete just for the censors who are watching. Hi, good evening. Hope you're having a good day. Although you're not watching because you're an AI algorithm, aren't you? You're an AI algorithm. You can't hear what I'm saying, or can you? But I know there is also a human element. So if you are part of that human element, come on, listen to what I'm saying. Join the club. There is a lot of analysis that's been done on the excess mortality during the first wave of COVID-19. And interestingly, some of that analysis has concluded a couple of things. First and foremost, one of the things that we've covered extensively over the last 2 years, probably hundreds of episodes have made reference to the fact that we had no proven diagnostic method for actually verifying a true case or indeed hospitalization or mortality as a result of COVID-19 as a direct result of. And to this day, I still speak to people who have had no skepticism for the last couple of years. And you talk about this and they can't get their head around that there was no proven diagnostic method for confirming COVID-19. They'll talk to you about PCR tests. They'll talk to you about other forms of testing. And again, I could point you to several episodes, in fact, tens of episodes, if not hundreds of episodes, where we've gone through how the testing, PCR tests will pick up fragments of a virus for 30 days, 60 days, 90 days, and you're really detecting small particulars. I don't need to go into that. Those of you who have watched the last couple of years know that detail, but the point is simple, that there is a potential exaggeration of COVID-related deaths. But that, you're looking at this, let's be transparent, this is excess mortality, it's not deaths from COVID. So there was an excess in mortality in the UK, way above what would normally be expected during that time. So the second point, which is an important one when we look at the overall excess mortality, is a lot of the analysis that's going on now is actually making reference to the same references that Chris Whitty has stated as a consequence of the shutdown of the healthcare system. And what people didn't believe when people were saying how hospitals were overwhelmed and overloaded during the course of the first wave of COVID, that simultaneously I was publishing the data from the health journals, which was saying that the hospitals were 40 to 60% empty. Yeah. And of course, the TikTok videos of nurses and doctors dancing, having the time to not only record a video of one person dancing, but an entire team of people dancing. In fact, cross-functional units of people dancing, not only just dancing, but dancing in a way that is choreographed to the point where they're in sync and can actually create a TikTok video or a shareable video where they're actually creating a routine to music. They're so busy that they have the time to create that as a bit of fun to cheer everyone up during the pandemic. You're so off your feet that you have all that time to create a TikTok routine. So whilst again acknowledging the sad matter at hand, we're talking about people dying here. We can't take that away. But I just want to come into the point here that one of the potential contributing factors of the high levels of excess mortality during that first wave is the same reason cited by Whitty and co. Is that the hospitals were shut down, which they were. The data shows that. The diagnosis, the treatments, people having heart attacks. If you look at the deaths at home during that period, people were dying from things at home that they would not normally die from. All of this was occurring during the first wave of COVID. So part of that excess mortality can surely be attributed to the fact that the entire healthcare system closed its doors to almost anything other than COVID-19. So then we have this little spike in mortality that happened at the beginning of December 2020. I can't remember what happened in December 2020 again. What major shift happened in December 2020? Can you remember what happened at the end of December 2020? Was that major medical rollout that occurred at the end of December? Did that begin then? Was that experimental procedure that started rolling out at scale at December? Yeah, yes, it was. And actually, is that an anomaly? Well, no, because we also created another video, which was also censored, unsurprisingly, which took 20 countries. 20 countries. We took this exact chart from 20 different countries from the same source, Our World in Data, and we showed that this anomaly is not an anomaly because it happened over and over again in 20 different countries. Someone else went on to do it in 100 different countries, showing the same pattern where that medical intervention began, and we saw the same excess mortality. Now, what Whitty is talking about is this prolonged period of excess mortality. So this baseline here, the 0%, is the expected level of excess mortality. So anything above this is beyond the projected level. So we've seen this we saw this huge spike during that period of time where there was a giant rollout of the medical experiment, and then a little dip. But then look, it's basically been above the expected level up to a point of 20% over the expected level consistently since. So of course, locking down the nation, we know that we've spoken to the children's doctors. My own son, my 15-month-old boy, he's had all these illnesses during his early life because the doctors are saying the kids didn't have the chance to have these normal respiratory viruses and things, the normal childhood viruses to circulate. Their immune systems would normally respond, but because they've had the absence of that, everything has become more intense. It's come back harder, longer, and lots of people have told those stories. There's loads of examples of children and adults alike who have suffered because the routine illnesses that would normally have minimal effect are having a much stronger effect. In addition to that, you've got the complete absence of the access to the medical system over the last couple of years, diagnosis, treatments, all missing. So it's clearly contributing. But then the big question is, does that big V, does the big injection contribute to this curve? I don't know. You tell me. What do you think? What is all the evidence that we've been talking about over the last few months, few years indicate could be contributing to this excess mortality around the world in tandem? You decide for yourself. You use your own education, your intuition, your own intellect, your own ability to research these things. Of course, lockdowns have caused excess mortality. It was entirely predictable. Of course, shutting down the medical system causes excess mortality, entirely predictable. And of course, rolling out an experimental drug at scale that has not gone through proper testing, proper trial procedures, proper control procedures, is going to have a probable effect on this curve. So yes, Mr. Whitty, we unfortunately are facing, sadly, a prolonged period of excess mortality, all of which, I might add, may have come at your very hand from the decisions that you and your fellow medical and scientific advisors have contributed to over the last couple of years. So yes, this is a Friday rant, and I am angry because people's lives have been screwed with, but they've not just been screwed with, they've been lost. And if you look at that chart, look at the consistency of the excess mortality, we're only just getting started. How many lives have actually been saved by lockdown policies versus how many lives will be lost because of the policies. I can tell you, as we've been predicting all the way through, that by a significant margin, the interventions that took place during 2020 and other times during the last 2 years the consequences will dramatically outweigh any possible benefit. Now, I'm not saying that we shouldn't have done anything. For those who are in high risk categories, there are things that we could have done. And I'm sure the good people like yourself and I, if we'd been asked, you've got an elderly neighbor who's concerned, we would have gone out of our way to support them. We would have done their shopping. We would have helped them out. We would have helped them stay active. Those who chose that path, we could have supported, and I would have done so willingly. I'm sure many of you would as well, if that was their choice. However, it should have been a choice, because I know many people who are in latter stages of their life. They may be high risk, they may be vulnerable, but they would have chosen otherwise. They would have carried on with their life, because the life in their view is for living, and they're willing to take a risk. That's the hard fact. But instead, no, we were all put under a blanket curve. 3 weeks to flatten the curve, 3 years to keep us suppressed and controlled. And the story continues. So this is my Friday rant. You're probably watching it on YouTube right now. That is until they get wind of the conversation I've just had with you today, and probably shut me down there as well. So I'm glad you're able to join me this evening. You can't watch on Facebook, as I shared, but please share this conversation. Take that YouTube link, go and post it in a Telegram group. Please share this episode. We need to find a way to break through these algorithms. We need to find a way to break through this big tech censorship. And we need to be able to have this. The serious point is we need to be able to have the conversation about these difficult issues. So if you'd like to join me in continuing the conversation, I invite you to join us in our private online network where we have no censorship. It's called the Elevate Network, and you can join us there at weareelevate.org. That's weareelevate.org. Join us there, and we can freely discuss the issues of the day without fear of reprimand. Thanks again. Have a great weekend. I'll see you again next week, and I look forward to seeing you soon.